All right, hello, Dr. Logan. My name is Akeem Dion Johnson, student physical therapist with the University of St. Augustine, and this is my differential diagnosis practical exam. My case number is number 3. As far as the red flags for my case, the first red flag is the patient reported an insidious onset of symptoms. The pain that she's reporting doesn't change with a change in posture. Her temperature is 102 degrees, and she also is in stage 2 hypertension with a blood pressure of 140/90. The 3 systems that I have in question are the cardiovascular system, ureterogenital, as well as musculoskeletal. The reason I'm going to be doing further screening of the cardiovascular system is because she's obviously stage 2 hypertension, and that warrants more investigation. I'm also going to be doing further screening of the ureterogenital system because the patient is reporting flank pain, which is consistent with kidney issues. She's also reporting a weak stream during urination, and also the temperature is kind of making me lean toward, am I dealing with a urinary tract infection? The third thing I'm going to be looking at in screening is going to be the musculoskeletal system, because the patient is reporting back pain and she also reports sitting down all day. So that can be an easy correlation between back pain that warrants further investigation. So some of the questions that I would ask for each system. For the cardiovascular system, I would like to know if my patient has experienced the onset of chest pain at rest and after exertion. Now I know that's basically 2 questions, but put myself in a real life situation, I would want to know both. Is she having chest pain as she's just sitting on the couch, or is she having chest pain after she goes for a walk or a flight of stairs? The second thing I would ask in relation to the ureterogenital system would be, has she had a recent infection which is leading to the elevated temperature? And the third thing I would like to ask is, has she recently experienced any trauma, like a fall or a motor vehicle accident, that we didn't pick up in the initial interview, which could be potentially the cause of the back pain? So from there, I was instructed to do an abdominal exam. From here, I have my patient here. So in the abdominal exam, we're going to start off, we're going to go through inspection, auscultation, percussion, and palpation. So we're going to start off with inspection. I'm going to have my patient lay back here. And do you mind if I pull up the shirt?
Mm-hmm.
All right. So we're going to pull up my patient's shirt here. Mind if I slightly lower your pants?
Mm-hmm.
All right. Just making sure we got all the quadrants properly exposed. We'll also drape our patient as best as we can given the current circumstances. So starting off, we're just going to be doing the inspection. In the inspection, I'm just taking a look from above and from the side at all 4 quadrants of the abdomen. I'm noting if I see any scars, any burns. I'm also going to be taking a look at the umbilicus to see if I could maybe pick up on a potential hernia. Another thing I'm also going to be taking a look at on my just inspection side of my abdominal exam is to see if I see any pulsatile movements, because that could mean I'm potentially dealing with an abdominal aneurysm. So just going through all 4 quadrants, just making sure there's nothing outside of the normal. After the inspection, we're going to go through auscultation. On auscultation, we're going to be bringing out our stethoscope. And we're going to make sure that this side is warm so we're not freezing our patient. And we're going to start off in the left upper quadrant with our auscultation. And we're going to stay in each quadrant with a nice flat hand contact. And what I'm listening for here is bowel sounds. I would stay in each quadrant for about a minute. The bowel sounds sound like tiny droplets. I'm looking to hear anywhere between 5 and 34 droplets. And I just got one there. In each of the quadrants. If I hear less than 5 bowel sounds, that would be hypoactive bowel movement. If I hear more than 34, that would be hyperactive bowel sounds. So after the auscultation and after the inspection, we're going to be going through with our palpation. Palpation is going to be 2 steps. We're going to start off once again in the left upper quadrant. We're coming in and we're just going to knock out our superficial palpation, just noting any inconsistencies and maybe any potential reproduction of pain that's going to be on our patient's face. After we go through the superficial palpation, then we'll move into deep palpation. And what I'm looking for in deep palpation, I'm pushing in a little deeper. I'm looking to see if I have any masses here. And also with the deeper palpation, if there is an issue in the abdominal area, we're more likely to get a reproduction of pain with the deep palpation. After the deep palpation, we're going to go through our percussion. Now, what we're looking to hear with the percussion of the abdomen area, the majority of the sound should be a sound of tympani, which means we are over organs that are gas-filled or liquid-filled, except for when we get to the right upper quadrant. When we hear a sound of dullness, that is indicative that we are on top of the liver. So we're going to go through each of the quadrants, starting in the left upper quadrant. That's the dull sound that we get when we get on top of the liver. As far as my results for case 3, my results were that my patient had right upper quadrant pain with palpation. As far as my special test, given everything that I have in the interview and everything that I have from the abdominal exam, the next thing I would want to do is a percussion test of the kidneys. So I'm going to have my patient come around and sit facing this way. And our patient's going to be sitting up nice and tall, and we're going to be coming over on that right side where we got the pain in the right upper quadrant for the percussion test of the kidneys. I'm coming in, placing my hand right below the 12th rib, taking the ulnar side of my other fist and trying to just percuss on the kidney. A positive test here with percussion of the kidney would be reproduction of pain, which could be indicative of kidney infection. Looking at my results from case 3, my special test was positive in the right upper quadrant. So gathering all the information, moving right into my differential diagnosis, when you take into account that our patient has reported flank pain, which is the same type of pain seen in the urogenital chapter. She has reported a weak stream during urination. She has a high temperature, which could be indicative of an infection. And she also has elevated blood pressure. Knowing the relationship between the kidneys and blood pressure, temperature, and infection, as well as flank pain and kidney issues, I'm going to say that we are dealing with an upper urinary tract infection. Also, in addition to the special test of the percussion of the kidneys being positive, I would refer this out to an MD immediately because upper urinary tract infections can be an immediate threat to renal tissue itself. Thank you.